And we are live today here on the Hair Debate. My name is Morello Kane. I'm the host of the Hair Debate. I'm a master cosmetologist, been servicing clients for over 20 years. And so it is my pleasure to bring with me today as a guest on the show, Dr. Katina Miles. How are you doing, Dr. Miles?
I am doing well today. Thank you for having me.
Oh, absolutely. And thank you so much for being on the platform, Dr. Miles. Dr. Miles is with Skin Oasis Dermatology. And when I tell you, Dr. Miles, she is coming on live here with us from out of Maryland. And so, Dr. Miles, tell us about, how long you've been in the industry. What brought you here to, in hair care, skin care, beautifying all the individuals out here? Please share.
Well, I am a board certified dermatologist. I graduated from my residency program in 2007. And since that time, I have focused really on hair care. What I
Yes.
have found with practicing is that hair loss in the African American community is an epidemic. We are losing
Yes.
our hair. And we need to not lose our hair. We need to keep our hair. It's our crown and glory. So
Yes.
it's one of my passions of treating hair loss. I've actually experienced hair loss myself, so I know how emotional it is
It
and
is.
how it really affects you. So I really feel the need to educate my patients about
Mhm.
keeping the scalp healthy. If your scalp is healthy, your hair will be healthy. Then we have a chance of growing healthy hair.
Yeah, yes, yes, yes. Okay, Dr. Miles,
Mhm.
thank you so much for that because what I love the fact is how you definitely identify what a lot of individuals are going through. And people don't understand how important hair is to our image.
Mhm.
Truly in who we are. And so we can't step out there and fulfill the purpose of who we are to be if we're not comfortable and confident in doing so. So thank you so much for addressing that.
Absolutely. If you think about hair loss, it's actually like losing a limb,
No,
part of us.
yes,
And so
yes.
it's part of us. So it's very important and we have to take care of it.
Okay, so now let's dive directly into this
Mhm.
because I have clients that battle scalp issues, and so I try to get them to understand that I can treat on the level as a professional hair care provider on my level, but there are instances where they must see our professional, which is a dermatologist.
Yeah, so it's a team effort. I think
Yes,
hairstylists, dermatologists, we need to work together. Hairstylists, you're going to see the scalp pathology first because
yes.
we go to the hairdresser, we get a hair done on a regular basis. As a dermatologist, one of the frustrations that I have is that I see the
Mhm.
hair loss on the back end when it's
Okay.
severe and
Yes.
chances of regrowing hair goes down. So I think
Yes.
working as a team where the hairstylists say, okay, there's some pathology going on here on the scalp. Let's have you go to see the dermatologist to see what's going on so that way we can treat. And so again, I like to focus on the scalp and the hairstylist, you guys focus on the hair.
Oh, I love that. I love that. And so when it comes to, let's talk about some different scalp conditions. Now on our level here as a professional, when we start seeing the scaliness, where clients are saying that okay, the scalp is itchy, they're scratching it, a lot of tension going on in one particular area, you
Mhm.
know. Um, and what I would seem to think that it would be is eczema. Okay. And so we commonly see that. So now how does eczema and some of the other scalp conditions, how does that affect the thinness of the hair?
All right, so if there is flakiness or scaling of the scalp, that can be a number of different things.
Okay.
Eczema can definitely be one. Next could be a condition called seborrheic dermatitis, which is a fancy name
Okay.
for dandruff. Your scalp will definitely be itchy. For seborrheic dermatitis, there is no cure. It will come and go.
Okay.
It normally flares during the colder months, and
Okay.
also change of season. And seborrheic dermatitis, we believe, is caused by the skin overreacting to a fungus that naturally lives on our skin.
Okay.
Next condition that can cause flaking of the scalp is psoriasis, which is not as common as seborrheic dermatitis, but psoriasis can cause itchy, dry spots in the scalp. And
Okay.
another condition that can cause flaking in the scalp is ringworm. And I see that
Oh,
a lot in adults and females,
okay.
a lot of times going to stylists which aren't using proper antiseptic technique, or
Wow.
using someone else's comb and brush or hat. So those are the four things. If there's scaling of the scalp, that is medical, and they should seek medical attention to have it checked out. And
Okay.
hair loss can occur if you're scratching that scalp. A lot of times hair loss can occur just from the trauma of scratching.
Mm-hmm.
Ringworm of the scalp, that hair loss can be permanent because ringworm,
Okay.
if untreated, can cause scar tissue. And if
Oh, wow. Yes.
yes, and if scar tissue forms, if that ringworm is there for years, it goes untreated, then
Yes.
permanent scar tissue can occur, and then the hair is gone. So if
Okay.
it's flaking of the scalp, a lot of times we'll put grease on the scalp and we'll
Yes.
call for aid, and this is medical. We should follow up with a dermatologist.
Okay. Okay. So guys, you definitely have it because we tend to do and operate out of traditions.
Mhm.
So traditionally, if you see any type of scalp, oh, I should have oiled my scalp. That's the first thing we want to go to. But again, we must understand again, as Dr. Miles stated, that is medical. And so for that reason, you must seek to know exactly what you're dealing with. Because again, just because you have dry scalp does not always indicate that you need to drink more water. Because we tend to go to that. We tend to what's comfortable, traditional, and we always like to self-diagnose ourselves. And so now, and as you stated before, not treating these things can result in a permanent hair loss, which is alopecia. Is that correct?
So any type of hair loss, whether it's permanent or not, is considered alopecia. There's
Okay.
about over 20 different types of hair loss. And I like to
Okay.
kind of separate them into scarring hair loss and non-scarring. That's kind of like the big buckets that I put hair loss into. So with non-scarring alopecia, that's going to be your alopecia areata, where you gotta get those nice round little spots of hair loss. That's when the
Mm-hmm.
immune system, for some reason, attacks the hair follicles. You can have something called telogen effluvium, which is hair loss caused by some type of internal trauma or external trauma. So that could be uh, death of a loved one, loss of a job, if you go on a crash diet, if your thyroid is misbehaving, certain medications.
Mm-hmm.
So I said nutrition, um, thyroid, if your iron levels are low, if you're anemic. So telogen effluvium is normally caused by something, some type of trigger. So if you had a major surgery, if you have something called androgenetic alopecia, that is
Mm-hmm.
hair loss caused by our hormones. So there's different types. There's female and male pattern hair loss. And that's just
Okay.
as we get older, we lose our hair. And so those are kind of the bucket of non-scarring, the most common. For scarring, what I treat a lot is more of the central centrifugal scarring alopecia and also your traction alopecia. And those
Okay.
type of conditions where, if not treated quickly on the early end, the chances of regrowing hair goes down.
Okay. 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 So now you stated something. There is an alopecia where the body is attacking itself.
Mhm.
Okay. So now could that possibly also come from taking medication?
So that would be in your group of the telogen effluvium. So
Okay.
certain medications can definitely contribute to hair loss, like blood pressure medications.
Okay.
And it's lower on the list. I kind of put that low on the list for contributing to
Okay.
hair loss. It's not kind of the top. I know that's the first thing that we all go to
Right.
or something. Most of the time, it could be just internally, we're not as healthy as we can be. So
Okay.
stress is definitely a trigger for hair loss, chronic
Okay.
stress. If you have diabetes, that in itself can cause your hair to shed, and the medication probably can add to it. If your
Right.
thyroid is not behaving correctly, that can cause hair loss. And then sometimes the thyroid medicine can cause hair loss. High blood pressure, that's a stress on the body. Our hair can shed, and then the medication can add to it. So
Absolutely.
you can do it. And certain medications, like if you're on chemotherapeutic medications, of course, that will cause hair loss. So yes, definitely medicines can play a part, but it's not a huge part.
Okay, so now we have a question. And guys, we have Dr. Miles here with us today. So if you have questions, please post them here. Post them here. Okay. She's definitely here to share on the platform. And so now, Ms. Brackett, thank you so much. We have a question. Why does hair that is pulled out comes back, but not hair that falls out?
So a hair that is pulled out, so for instance, if you have a tight style, like weave, cornrows,
Yeah.
braids, locks, and you have some edges pulled out, that hair is gone. The
Okay.
other hairs may grow back. It depends on how much trauma has been
Yes.
put on that hair follicle. And I liken tight styles to a fight, but instead of it being a quick fight where you get your hair ripped out, it's a slow pull.
Okay.
That's how I liken many of the styles that are supposed to be protective. I find that
Yes.
it may protect the hair because you're not doing like styling, but it's not protective of the scalp. So with that question, regardless if your hair is pulled out, if there's a lot of trauma, the hair is not coming back. If your hair
Okay.
falls out, it depends what's causing that hair to fall out. That hair can come back.
Yes.
So it just all depends on why that hair is falling out.
Exactly. And again, understand that trauma, that in what is done on the scalp, if it forms scar tissue, then that hair follicle depletes the nourishment that it needs to thrive. Is that correct? Or am I off?
So what happens, for instance, if we have some type of trauma to the scalp, tight styling can contribute to trauma to the scalp. It's not the
Yes.
full story. We've actually found that certain scarring tissue or scarring of the scalp is caused by genetics. So it can run in
Okay.
the family. So that's within about like 2 years ago, we found that there is a gene that can contribute to us losing our hair and forming that scar tissue. And I'm sorry, what was your question?
No. Great, Dr. Miles. Jess, okay, so now with that trauma being done on the scalp, then it's that layer, it's that the scar tissue. That is what prevents the nourishment to that follicle.
Right. So once that scar tissue is there, the follicle can't thrive. So
Yes.
think of the scar tissue as when you scrape your knee, when you look at that knee, there's a scar there. The same type of scar happens in the scalp. When there's scar tissue, that scalp is not as healthy. And
Okay.
the follicles, they just don't have the support and they can die. And eventually
Okay.
the scar tissue just runs over all the hair follicles and they're gone. So
Okay.
way.
Yes, ma'am. Yes, ma'am. So now let me ask you this. Genetic alopecia. Okay, so now when an individual go in to be tested, and assessed when it comes to that, are you able as a dermatologist, your profession, are you able to look at that in from the naked eye and say, okay, that's genetic alopecia, or are there special tests that you guys must do?
So a lot of times when someone comes in and I'm evaluating their scalp to find out what type of hair loss is this. Certain cases, they come in, you're like, you know what, this is androgenetic alopecia, and a biopsy is not needed. Sometimes it'll be a combination of androgenetic alopecia and telogen effluvium. And in those cases, I say, we may need to do a biopsy. Other cases, it could be a combination of, I have a patient with androgenetic alopecia and central centrifugal scarring alopecia. So a lot of times it's clinical, what the patient tells me, it's what I see. Sometimes I'll do blood work and a biopsy. So it really depends on the patient and what I'm seeing at that time.
Okay, so there are cases where you can look at that patient as you're evaluating them and say, you know what, that is genetic alopecia.
Right. I can say this is androgenetic alopecia. This is post-scarring alopecia. This is traction alopecia. A lot of times you can clinically look at the patient and say, okay, this is the type of hair loss that you have. But sometimes it can be tricky, and a biopsy definitely will help. I also use something called a dermatoscope, where it's like a little scope where I take a look at the hair follicle.
Yes.
So that way I can see, what are the follicles doing? Do I see scar tissue? Do I see little baby hairs? Is it possible we can get any type of regrowth?
Yes.
Is all the hair gone? So that's another measure that we can use when we're doing the clinical examination.
Okay, so let me just say this, Dr. Miles. You got really excited when you said, "Do I see those little baby hairs?"
So,
I thought I was the only one that got excited when I I saw it in your eyes. Because as professions,
yes, we have hope, right?
No, you get excited, right, when you see baby hairs.
Yes.
Because you're like, yes, there is life. Okay, there is life. No. And so I got tickled when I saw the when I saw the sparkles in your eyes. I was like, yes, she gets it. Okay. So we have a question here.
Okay.
So if I drink enough water, there are no scalp issues, meaning dermatologist cleared. What is the best way, or should I moisturize? So what's the best way? Should she moisturize her scalp?
So we've been taught as Black folk to grease our scalp.
Yeah, yes.
So we really don't need to grease our scalp. If your scalp is dry and flaky, that means most likely the most common cause is seborrheic dermatitis. If that's the case, you can start off with a shampoo over the counter, anti-itch shampoo. Use it more as a scalp treatment. You don't use it for the hair, because all of the anti-itch shampoos, even the one made for African American hair, can dry your hair out. If you're drinking water, that's good for everything, regardless if your scalp is dry or not. So just drink your water. But if you are well hydrated, that will not stop you from getting seborrheic dermatitis.
Okay. Yes. So now,
what I do want to say one other thing. So we don't necessarily need to grease our scalp, but we do need to put the hydration on the hair. That helps with styling the hair, helps whatever we're doing, combing, brushing, for it to glide better and decrease the chance of breakage.
Absolutely. And it gets it on those ends, because that's the area that's depleted the most, when it comes to moisture. So get it on those ends. But okay, so Dr. Miles, so I heard about this technique, and I, was truly excited, because I know that individuals are truly, this is a technology that is used to truly trump in what we thought of being hair loss and hair just being gone forever. And that is the PRP injections. And so can you please shed some light on what that is, how long is, been existing, and what type of results, and who is the ideal candidate for it? I know I just threw a lot at you, but yes.
All right. So PRP stands for platelet-rich plasma. And that is a technology where we actually take your blood from your arm. It depends on which system is used, but anywhere from like 15 to 30 cc's of blood. We concentrate the platelets from the blood. We process it, and then we take those platelets, which have been concentrated, and inject that into the scalp. This technology has been around actually for probably a good 20, 25 years. It was in dentistry for during oral surgery. Orthopedics use it for surgery of the joints. And as dermatologists, we started using it, I would say, anywhere from like about 7 to 10 years ago. What we found is that PRP, or your own platelets, have growth factors. And those growth factors help to support the health of the follicle. And I love to use it for patients with androgenetic alopecia, or the male or female pattern hair loss. I also have found that it is helpful for patients with the scarring type of hair loss, centrifugal scarring alopecia. With that, I like to use it in the earlier stages or moderate stages. With the severe hair loss, regardless of what treatment you try to do, the follicles are gone.
Okay.
I've had some patients where I start using cortisone injections to see if we can kind of stimulate some growth along with minoxidil.
Wow.
I see
Okay.
some movement. Okay, let's throw that PRP in there, and that's going to hopefully just help to add more nutrients to the scalp. So I love doing PRP. I've had good results. Just like other treatments, it's not a cure, it's a treatment,
Hmm.
but it is an effective treatment.
Oh, I love that. I love that. Okay, so now individuals, so we're talking about in the mild, in the beginning stages, when alopecia is mild,
Mhm.
that's when individuals realize that thinning is existing, and so, but okay, so now let me just say the importance of when you realize that you have thinning hair to go ahead and seek a dermatologist, a professional, um, a specialist in this industry, because again, it's important to catch this in the beginning, earlier on versus latter, in the latter stages of it.
Yeah, it's really important. What I find most people, the first sign is, this isn't growing as quickly as the rest.
Yes.
That's normally the first sign, and it's very subtle.
Okay.
And then you'll say, oh, my hair's thinning a little bit. And then to kind of cover it up, we'll get a braids or we'll get a weave or
Yes.
kind of camouflage. And then that traction possibly can contribute to additional hair loss. So it becomes the cycle. So the first sign of hair slowing down, the first
Hmm.
sign of the scalp feeling tender or itchy or painful, don't ignore it. Seek treatment.
Yes, absolutely, absolutely. And so when I tell you, you have given so much great information out here to these individuals that is battling right now. And hair loss can take you straight to depression,
Mm-hmm,
which again can lead to furthering that condition because of the stress that the body is going through,
mm-hmm, mm-hmm.
internally. And so now, what other factors, Dr. Miles, that you do when it comes to treatment? Any type of special solutions that you may have or that you sell?
Yeah, so I have a hair serum that has red clover extract, which helps with supporting the health of the follicle. I
Okay.
also I love Nutrafol and Viviscal hair vitamins, and those actually have a marine extract. So if you're allergic to fish, you can't use them. But that it has collagen, it has biotin. Biotin by itself does not regrow hair, so that's a myth. Um,
Oh,
I know, right? So
what? Wait. Oh, now you cannot drop the mic on that like that, Dr. Miles.
so biotin by itself does not regrow hair unless you have a biotin deficiency. So it's important not to do the mega doses of biotin. Small doses are totally fine, but you want to have it complex with like a marine extract, different nutrients to help to support the hair follicle. So the only vitamins that I really like at this point would be the Viviscal or Nutrafol, which are
Wow.
vitamins. Um,
Okay.
Other treatments that I do, I said I do the cortisone injections, minoxidil, and a lot of people don't like minoxidil because they say, "Oh, once I start, I have to keep using." Well, yes, because there's no cure for hair loss.
Okay.
But that is FDA approved, and what minoxidil does, and the other name for it is Rogaine. It keeps your
Okay.
follicles fat. It keeps those follicles in the growing phase, and that's what you want to
Okay.
do. So
Yes.
with hair loss, it's all hands on deck. You want to have a good stylist that really is into hair care.
Yes.
But a dermatologist, if you have something going on with the scalp, that's going to keep your scalp healthy. You may have to do
Okay.
cortisone injections. You may have to do minoxidil. You may have to do the hair serum that we have in the office, which I call hair serum.
Yeah.
Um, we have the hair vitamins and then PRP. And there's newer technologies that are coming out. There's a
Hmm.
Keralase laser, which I'm thinking about getting in the office. I've kind of held off because of COVID.
Okay.
See how things go. But Keralase laser is kind of like PRP on crack. It's just lots of
Wow.
growth factors that we use. Exosomes is another newer technology that's kind of in flux right now. So there's a number of different things that's coming out, and I'm excited that research has actually found a gene for starting
Yes.
So now we can do research to see, okay, how can we combat this genetic condition?
Okay. Okay. So, Dr. Miles, I must go back to this biotin, okay, because you have truly shared something that us as professionals, I mean, when it comes to strengthening the hair, growing the hair, we want to say biotin the first, go, take some biotin, order, so now let's talk about this biotin. So biotin alone does not grow the hair.
It
What about
does.
strengthening the hair?
It may strengthen. It's not going to grow the hair. So if
Okay.
there's something like, any of the conditions that I mentioned, the telogen effluvium, the androgenetic alopecia, the central centrifugal scarring alopecia, the traction alopecia, it's really not going to regrow hair.
Wow.
So if you have a biotin deficiency, it
Exactly.
it will. It's just like if you have iron deficiency, if you
Hmm.
get iron, that's going to help to regrow your hair. Or if you're anemic because of iron deficiency, if you're low in B12, because there's another
Hmm.
type of anemia, if you replenish whatever nutrients you're missing, then that can help to regrow hair. So yeah,
Wow.
not and I really warn people about taking super mega doses of biotin
Exactly.
because it can interfere with your blood work. For instance, if you're having a heart attack, you go into the emergency room, you may
Okay.
not detect the levels that we would see because of high levels of biotin. High levels of biotin can also
Wow.
disrupt your thyroid test. So high doses of biotin you really want to be careful about.
Okay. Okay. The information, Dr. Miles, that you have shared today is truly epic. Because again, we tend to think that biotin is one of the things, like we go straight to biotin. This is like this, hallelujah type of pill when it comes to hair growth. And so you truly shared some information there that I think that is definitely, again, I will have to address it and talk about it, because now, and that's what the hair debate is about,
Mhm.
is to share information, and that we may not all agree or have known about it, but it's the truth. We have the specialists here, and so definitely, guys, and because I've talked about taking, like, are you taking the correct dosage? Maybe you should take more, but then again, that explains what you just stated, was that if you're not seeing the results of it,
Mhm.
and because again, if you don't have a deficiency in it, it's not going to help you.
Mhm. And then
You
also,
know, it's
right, and it all depends on the type of hair loss. For instance, if you have end-stage scarring hair loss, vitamins really aren't going to be helpful. So it's kind of finding that sweet spot.
absolutely, absolutely. So, Dr. Miles, where can our viewers follow you? This hair serum, yes, ma'am. And what's in it again, please?
Red clover extract. That's the main ingredient in the synergen complex, and that just helps with supporting the health of the hair follicle. There's no minoxidil in it, so if you're pregnant or if you have an allergy to minoxidil, this is a good option for you.
Mhm.
So my Instagram page is Skin Oasis Dermatology, and my website is skinoasisderm.com.
Okay, so we're going to place our information here in the comments. You guys will definitely be able to get it. Definitely go and support, because again, Dr. Miles has given some great information, and very knowledgeable when it comes to alopecia, treating it, and the solutions behind it. So I thank you once again, Dr. Miles, for being a part of our broadcast. Again, my name is Morello Kane. This is the Hair Debate, the platform where we come to debunk, debate, and discover all things hair. Thank you again, Dr. Miles.
Thank you so much for having me. I enjoyed it.
Yes, enjoy your day. Thank you.
Thank
Your evening. Bye
you.
bye.